New report in the Wall Street Journal says an upcoming RFK Jr. report on autism will show that there could be a link between pregnant women's use of Tylenol and autistic children. HHS has pushed back on the reporting, saying, quote, "We are using gold standard science to get to the bottom of America's unprecedented rise in autism rates. Until we release the final report, any claims about its contents are nothing more than speculation," end quote. Tylenol maker Kenvue stock tanked after reports of that link to autism were released, but the company put out a statement defending their product, saying, quote, "Nothing is more important to us than the health and safety of the people who use our products. We have continuously evaluated the science and continue to believe there is no causal link between acetaminophen use during pregnancy and autism." It comes a day after Kennedy faced a contentious grilling from the Senate that had even some of his Republican supporters questioning his leadership. Joining us now is Dr. Tom Frieden. He's the president and CEO of Resolve to Save Lives and former head of the CDC. His newest book, The Formula for Better Health, How to Save Millions of Lives, including your own, is out later this month. So, Dr. Frieden, there's been studies out there before. Is this just a renewed focus, or how much credibility does this have?
Well, let's step back a little bit. First off, what we've seen is a steady increase in autism diagnosis as there's more recognition, and really good studies from the Centers for Disease Control and Prevention over many years also document that there's a true increase in autism. It's important we recognize autism is a spectrum. There are a lot of different conditions, and it's very unlikely that we're going to find one cause that's causing all of the autism. We do know that certain things increase the risk of autism. For example, increasing parental age, and parents are getting older these days in the US, does increase the likelihood of autism. Things like folate deficiency does increase the risk of autism, and still between 1 in 6 and 1 in 3 women who are pregnant get too little folic acid. That's why it's so important to take folic acid pills in consultation with your doctor if you're pregnant. The new study is actually not new data. It's a new analysis of many, many studies. And it suggests that there may be a role for Tylenol in some people who develop autism, but it's far from definitive.
And there are a lot of doctors out there that link these two together. I wanted to play this, and we'll talk on the other side. They found that in utero exposure to acetaminophen increases risk of autism as well as attention deficit hyperactivity type disorders. And the higher the dose, the longer the duration, increases this risk further. Now, we think this happens because acetaminophen can cross the placenta and it can interfere with the developing fetal brain with the chemical and hormonal signaling. What's your response to that?
It's a possibility. And you know, this is a really tough problem because other painkillers are definitely not safe during different parts of pregnancy. And pain is bad for the developing fetus as well. So you really have to consult with your obstetrician. We like to avoid all medicines that aren't necessary, but some medicines are necessary sometimes. So it's a challenging problem, and it's one of the reasons we really need a strong Centers for Disease Control, a strong CDC. It was the CDC that figured out that folate deficiency is a big cause of neurological problems in kids, and those have been drastically reduced in the US and around the world because of that. We have further to go with reducing folate deficiency in pregnancy, and that's one of the things that could lead to healthier kids. This kind of investment, not just in infectious diseases, but in the things that are making Americans sick, disabled, unable to do what they want to do, this is what we expect from public health, and this is what public health can do if we empower it, if we support it, so that we have more choices and we can live a longer, healthier life, and we can know what the data shows.
So you mentioned a strong CDC there. I wanted to ask you, do you feel the CDC is strong right now?
Right now, the CDC is really going through very difficult times. You had a gunman fire 500 rounds, doing extensive damage to 4 or 5 or 6 buildings of the agency headquarters. You have had the first ever firing of a director of the agency after less than a month. You've had most of the senior leadership resign in protest. You have half of the Centers for Disease Control and Prevention that have been shuttered, and you have more than 2,000 staff let go, including programs that address cancer, heart disease, lead poisoning prevention. When Wisconsin asked for help with a lead poisoning problem, there was no one at CDC to respond to that request. That has never happened before in the 80 years of CDC's history. And with new vaccine recommendations coming out of this department, many people will have a lot of trouble if they want to get a vaccine against COVID, getting it this fall. That's a real problem.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.